On the 25th of June, Friday, the Ritshidze project launched a detailed report into the state of public healthcare system in the Northwest. Now, the report, based on the results of data collected through Ritshidze's community-led monitoring, was presented to the Northwest Department and other health duty bearers at a community meeting. Ritshidze is providing this platform for community members to raise concerns directly to Northwest Health Department and partners working within the province. Now, the embargoed report has already been made available. Joining us to discuss this is Anele Yawa, the General Secretary of the Treatment of Action Campaign. Anele, it's a pleasure to be talking to you this morning. A very important report. Can you just first give us the background and why it's so important that this, these surveys take place?
Good morning to you, Bushe, and the viewers at home. Firstly, the importance of this survey is for people living with HIV, TB, and public healthcare users of South Africa, more especially in the 27 districts that are monitored by PEPFAR in South Africa, is to create a platform for the public healthcare users to engage directly with duty bearers and with those in authority on issues related to quality of healthcare services, to quality improvement of services related to HIV and TB. You will remember in our clinics we've got what they call suggestion box, complaint box, we've got structures like your clinic committees, but all these systems do not work because if these complaint box and these clinic committees were functional, many people who are experiencing challenges in our public healthcare facilities were not going to experience these problems, and these problems are not attended. But because these structures and these systems are not there or are not functional, so as the public healthcare users, organizations like your Treatment Action Campaign, NAPWA, Positive Women's Network, Sanarela, Positive Action Campaign, we took it upon our shoulders as the mouthpiece of the public healthcare users to go to clinics, to monitor the services that are meant for the people of South Africa, whether they are provided adequately, and then where gaps are identified. We are coming up with possible solutions, and we sit around with facility managers, district health managers, provincial HODs, up until to the Director General of Health, and say, in this clinic, in this district, in this province, here are the gaps that contributes to many people not to access quality healthcare services. But also you will remember that in South Africa, we've got HIV program. In South Africa currently, we've got about an estimated 8 million people who are living with HIV and about 5 million people who are accessing ARVs, whilst we've got another 3 million that is not yet initiated. But within that 5 million, as the country, we have since realized that there are a number of people who are lost on follow-ups and who are defaulting on treatment. And there are a number of issues that makes people living with HIV to be lost on follow-ups or to be missing from the program, starting from staff attitudes, starting from issues of stigma and discrimination, going to issues of non-availability of medicines at times in our clinics, and also going to long waiting hours where people will spend about 4 to 5 hours waiting in those clinics for medicine. So the question now we are bringing on the table is to say, now that we have identified these problems, what are the possible or workable solutions that can make sure that we turn around the situation and make sure that those who are lost or who have defaulted on treatment, when they go back to treatment, they are welcomed back and initiated on treatment so that no one is left out.
I mean, having a look at the report, it suggests that a lot of the people that would be defaulting on treatment or that aren't able to get the treatment is as a result of shortages in particular or no medication within the clinics. You have mentioned that you've raised that. How is government looking at addressing that issue? I mean, it's quite paramount. Some of the stories you hear of people who send their children or go themselves, they come from far, they wait for long, only to be told that they cannot be helped, and then they send elsewhere, which, of course, is not something that's ideal.
So in March this year, we went to a meeting which is chaired by the Deputy President of the country. Deputy President Didi Mabuza is the chairperson of the South African National AIDS Council. In March, there was a SANAC plenary where all government officials, ministers and premiers were part of that meeting, where we tabled a report similar to this one. And that in that meeting, the Deputy President promised that he is going to go down to Northwest with the SANAC civil society, with the Premier and other role players to a fact-finding mission on the issues that were raised in our report. We were told by the Office of SANAC and the Office of the Deputy President that next week, Monday and Tuesday, the Deputy President will be in Northwest making a follow-up on the report we issued in March. But now there are new issues that have been included on the report that we presented Monday. We hope that our national leaders, like National Chairperson of TAC, Sibongile Chabalala, and the General Secretary of NAPO, Amluleke Zazini, will join our colleagues who are working in Northwest when we are engaging with the Deputy President about all these issues, because we strongly feel that the Deputy President of the country, as the chairperson of South African National AIDS Council, has to provide leadership on the problems that we have raised in Northwest. But also, this responsibility must not fall on the shoulders of the Deputy President. We want the Premier of Northwest to provide leadership, because we cannot have premiers who are meant to be chairpersons of AIDS councils in provinces, and when leadership is expected from them, they are not there. But also, the MEC of Health, the HOD of Health, we need to sit around on the table with them and say, now that we have presented this report, how can we discuss issues that seek to address the challenges that have been raised in the report? Also, we must remember that Northwest is still under the National Administrator. How do we sit down with the National Administrator and say these are the challenges with regards to access to medicines, quality of services, infrastructural issues, staff attitude, infection control issues, and all other issues that we have listed on the report?
I mean, there's plenty of issues that you are just mentioning there, and you know, for the sake of time, are you able to just touch on some of the recommendations that are in the report, especially when it comes to the likes of staff as well as that the shortage of medicines?
So one of the key recommendations that we have on the report around the issue of staff is that, one, we know that a number of frontline healthcare workers have succumbed to COVID-19. So, and also there are vacant posts. We are calling for a turnaround human resource for health plan that will make sure that we've got more healthcare workers. Also, we are calling for a turnaround plan around issues of access to medicines. You will remember that in Northwest, we're still having senior officials who were working in the provincial depot who are suspended for more than 2 years on a full pay, and we strongly believe that if that matter can be addressed, issues of medicines and medical supply can be addressed. But also, what about also the national government and the implementing partners? Because normally we are being told about the buffer stock. So what are plans in place so that when the province is running out of medicines, how do we make sure that national government comes to the rescue and the implementing partners? Issues of staff attitude that leads to people leaving facilities without being helped. Issues of infrastructure, where you notice that most of the clinics are very small and very old, and there is no infection control. And even when people are observing social distancing, they are forced to stand outside, and there is no shelter, and people, they are not provided with chairs to sit down. But also, the other question that we need to address is the issue of the migrants. In Northwest, there is a community of migrants, documented and undocumented, and most of them are not accessing adequate healthcare services in our facilities because of sometimes they don't have documents, or those who have documents, the way they are treated in our clinics, they are treated as subhumans. So these are some of the issues that we want to discuss with the Northwest government, because we strongly believe that during the time of COVID-19, we strongly believe that nobody must be left out. If health
Absolutely
is a fundamental human right,
let's leave it there. Thank you so much for your time this